My dear fellow future colleagues, I welcome you all in this virtual scientific conference, Bangladesh International Medical Student Scientific Conference 2020. All of you know, I am Dr. Basana Rani Muhuri, ex-professor of Paediatric Nephrology, Department of Paediatric Nephrology, Chittagong Medical College, Chittagong, Bangladesh. I am today very happy to be here with you all. Before my presentation, in this pandemic situation, I want to convey my gratitude to all who have left us till date. I am praying for their eternal peace, and also I am praying for the early recovery who are still suffering from COVID-19. I am so happy. Why? Because our future generation, you are very much interested to hear about a disability. Among 12 designated disability in Bangladesh, one is the hidden disability, that is which cannot usually seen, which almost all remains covered, and you are averting this one, that is the autism spectrum disorder. So my topic is understanding autism spectrum disorder from medical perspectives. Why medical perspectives? You are the future physician, our professional. All of you know that about 1% of our population are suffering from autism spectrum disorder. And one information I am giving to you before the actual topic, about 55,000 autism spectrum has been designated in the National Disability Survey, of which only less than 6% has been documented before 5 years of age. That's why this is the topic, and your work is to diagnose, and your part is to diagnose before 5 years of age in your future professional place. That's why I am putting these topics before you. And in next 40 to 50 minutes, I will talk on these topics from introduction to conclusion. Let's start. What is autism spectrum disorder? Autism spectrum disorder, it's not a disease, it's a condition, and before it was acquainted with the pervasive developmental disorder, is a phenotypically heterogeneous group of neurodevelopmental disorder characterized by challenges with social skills, restricted and repetitive behaviors, speech and nonverbal communication. I will explain all this in coming time. So it's not a disease, it's a condition. Autos means remaining within himself or herself. And now this autism spectrum disorder is over the umbrella under which there are the pervasive developmental disorders. All of you know that in ICD-11, that is International Classification of Disease, it is under the number 6A, in which it is written from 0 to Z, a different name with or without intellectual disability, and according to its severity. You will come to know everything in future. Before, the autism spectrum disorder was designated in Diagnostic and Statistic and Manual 4 as the pervasive developmental disorder, having 3 conditions in the triad: the social impairment, speech or communication deficit, and language delay, repetitive behaviors, and restricted interest. But since 2013, it is in the DSM-5, having 2 criteria. One is social communication, and another is the restricted and fixative or repetitive behavior. There is a long history of autism, though not too long, but it is not too short. It was first described by scientist Eugen Bleuler in 1908 as a subset of schizophrenia. Then after, the actual name of childhood autism or early infantile autism was described by Luke Kenner in 1943, who has seen 11 children who are intellectually high but remain alone. And then after, in 1944, almost at the same time with Leo Kanner, a German scientist, Hans Sperger, described a group of children with very high intelligence, but they prefer to be aloof, the Sperger syndrome. In 1967, there is a storm among the mothers. Why? Because he designated all the mothers of autistic children as the refrigerator mother. But later on, hopefully, it has been disproved that mother no way responsible for that autism. And in 1980, infantile autism is listed in the American Diagnostic and Statistical Manual of Association of Psychiatrists. It is the actual designation. And in 1988, all of you know about the movie Rain Man, in which a person with autism, Shah Rukh Khan, has been in the scene. And in 2007, in the family, it is the year, it is the day, is very much important, because the autism spectrum disorder has been adopted by the United Nations as a world problem in the developmental field and designated 2nd April as the World Autism Awareness Day with light it a blue. And in 2013, the actual figuring of the autism spectrum disorder in Diagnostic and Statistical Manual 5 of American Psychiatric Association designated as the autism spectrum disorder. This is the short history. Now, all of you see, this is the universal sign of autism. Why this ribbon? What does it indicate? This ribbon indicates that the complexity of the autism and different color and shapes represent the diversity of the peoples and families living with the condition. Why? Because each and every autistic children or person with autism are unique. No are similar with the another one. So individual is unique one in the spectrum of autism. Now come, what is the epidemiology? Why we are talking with autism so much? Why there is Autism Awareness Day in the world? Because it is a very rapidly rising disease which become evident, or symptoms become evident 1 to 3 years of age. And if you maybe over before 1 year of age, and sometimes because of milder presentation may be diagnosed in the later life, but most common age of uh, uh, appearance of sign symptoms is 18 months to 3 years of age. So most of the children, if we are committed, we can diagnose before 3 years of age, because early intervention is essential for early diagnosis. And there is no racial, no country, no variation from social class to class. Just you see the figure. In 1975, it was 1 in 5,000. And in 2020, it is 1 in 54. So you can easily imagine what is the rapidly rising prevalence of autism spectrum disorder. So you can imagine the situation. With a medical professional, we have to identify this condition in the earliest stage, so that our children can be like a human being included in the society. And in this condition, boys are more affected than the girls. It is 4 times than the girls. What is our scenario? We have to know about the Bangladesh scenario. Though we have no much vast data, but there are some small data which are the indicator of our scenario. It is not so small. In 2005, it was found that it is 0.2%. And in 2009, it was done in the rural area. In 2009, in 8 division, it has been identified that it is 0.84%. And a survey in 2030 in 8 division, 8 site, both rural and urban area, it has found that it is in the rural area, it ranges from 0.15 to 0.07%, and in the urban area, it is 3%. It is 3%. It is alarming. This is though a small survey, but it is an indicator in the health sector what we the professional have to do for this group of peoples to include in the society. Do you know what is the etiology and what is the pathogenesis? Still it is not clear, but scientists has revealed that there is a definitive correlation with genetic factor and environmental factor. In some cases, they have found some immunological factor, and some risk factors are associated with pre and perinatal factors, and comorbid neurological disorders sometimes also associated with autism spectrum disorder. What is the proof behind the genetic factor? Because it has been found that if one children in the family is affected, the chance of occurrence of the subsequent shifts, it is 20 to 80 times more. And if in twin babies, it is much higher. And in the family, in the descendant siblings or in the extended one, it has been more than that of the other families. So there might have the genetic correlation. And some genetic syndrome also has more prevalence of autism, like Fragile X syndrome and tuberous sclerosis. So all these suggest that there is definitely there is a genetic correlation, but not in all cases. And some other genetic factor which are related to the brain development along with the biomarker are that there's an increase in the size of the brain from birth onward. By age of 5 years, it increases 15 to 20% in comparison with the normally neurotypical babies. And there is increase in the size of the amygdala and stratum. This is the scientific evidence-based findings by different scientists. So it is one of the pathogenesis of occurrence of the autism spectrum disorder. What is the immunological factor? In some research paper, it has been seen that some maternal antibody may enter into the fetal circulation, which may alter the neurological development of the children. And later on, in those cases, there is prevalence of autism is much more in comparison with the other. Some of the risk factors are also associated with development of autism spectrum disorder in future. Those are some prenatal factors and some perinatal factors. The prenatal factors are the advanced maternal and paternal age at birth of the child, maternal gestational bleeding, diabetes mellitus, and first-born baby are more prone to develop autism spectrum disorder. And the perinatal risk factor are birth trauma, fetal distress, low birth weight, low Apgar score at birth, congenital malformation, and hyperbilirubinemia and ABO-RH incompatibility. Not all cases. In some cases, this risk factor has been found in different literature. Now let us see. Actually, we do not know what is the etiology. We do not know the actual pathogenesis. So how we can diagnose autism spectrum disorder? The diagnosis till date is by clinical observation. There is very limited role of laboratory test. Laboratory test only indicated if there is any associated condition or comorbidities to rule out some other differential diagnosis. So In practice, the typical autism spectrum disorder could not be diagnosed till date by any laboratory test, only by observation. I have told that there is DSM-5 since 2013, that is Diagnostic and Statistical Manual of the Association of American Psychiatric Association. There are two classifications. Those who have social communication impairment and repetitive and restricted behavior, they are under the typical autism spectrum disorder. You just remember, must have social communication impairment and restricted and repetitive behavior. If only social communication disorder, that is those who cannot communicate with the other person, but having no repetitive or restricted behavior, they are labeled as social communication disorder only. And what are the criteria according to DSM-5? The criteria A is the persistent deficit in social communication and social interaction across multiple contexts, as manifested by the social emotional reciprocity deficit in non-verbal communicative behavior. We can express ourselves either by talking or by facial expression, by our posture and gesture. If this is persistently absent in a child or a person, and also there is deficit in developing, maintaining and understanding the relationship with family member, with the community, with the neighbor, all three are the important sign of autism spectrum disorder as a persistent deficit in social communication. The second is the restricted and repetitive pattern of behaviors and interest and activities to some specific object. How they are evident? They are evident by the stereotyped or repetitive motor movement or object. If they take an object, they remain whole day with the object. They sometimes stare. They look at the fan and move around it. And highly restricted and fixative interest. If their choice is one shirt, one sari, one genji, they only put it on their only. They do not like to put on other dress. And hyper or hypoactivity to sensory input or unusual interest in sensory aspect of the environment. All of you know that we have 5 sensations: vision, hearing, smell, taste, touch, temperature, and proprioception. Another coming is the interoception. These are the feelings of a human being. This sensation in the spectrum of autism, they have different. Somebody have the low feelings and somebody the high feelings. That's why you see a boy or a girl or a child having the autism spectrum sometimes take smell of hair, smell of somebody, goes to somebody and take the smell of the body. That is because of the sensory difference. So if among the two groups, the first three in the persistent lack of social communication disorder and among the group of restricted and repetitive behavior, the 4 subtypes, it two remain. These are the diagnostic of autism spectrum disorder. And these symptoms must present during the developmental period, that is in the early childhood, and symptoms cause clinically significant impairment in the social, occupational, and other important areas of current functioning. That is, they cannot communicate, they cannot express their feelings to the others. Sometimes you say that this girl remain alone, this boy remain alone. This is one type. If it is persistently occurred within them, it is one of the sign of autism spectrum disorder. And this autism spectrum disorder, along with this specific criteria, may have accompanying intellectual impairment, may have language impairment, and may have genetic condition, and sometimes may have another neurodevelopmental condition with catatonia. And according to severity, in the DSM-5, they are leveled for their service requirement in level 3, who require very substantial support lifelong, and level 2 requiring substantial support, and level 1 requiring support. They may lead a normal life who are in the level 1, and from the level 2, most of them can go to normal life, but some may remain with support. I will show you video in the later part of my presentation. This is the slide in which have a look with the signs of autism. Here they remain alone, only prefer one type of cloth, inappropriate laughter, and there may be poor at speech, cannot talk, oversensitive to sound, inappropriate playing with the toys, and lack of awareness of the danger, and hyperactivity with just throwing balls and just jumping in here and there, going from one room to another room. A strained attachment to object. If you want to take one object from him, he do not give it to you. And lack of eye contact. These are the early few signs of autism. What we see in autistic children, it is just a small part. Most of them remain under the within him, just like the iceberg. When we see iceberg, a small portion we see. Most of part remains under the water. Autism is like that. A few signs and symptoms we see usually, but why these symptoms? Most of them remains within himself. We have to elicit out for a proper intervention. So, at a glance, what is actually the autism spectrum disorder, and what is the etiology, what are the other associated conditions? I have already told, in the context of social communication and interaction, these three must have, and in the context of restricted and repetitive behavior among the four, two must be there. We may reveal under DSM-5 as the autism spectrum disorder. And the etiology, I have described the genetic condition, and some biomarkers are related. There may have abnormal EEG, and 30 to 40% may have seizure at any time of life, may have constipation, anxiety, agitation, and hyperactivity or impulsivity, and most of them have the language impairment. Actually, parents comes to doctor for the concern of a speech mostly. So a speech defect is one of the important feature, though they hear but they cannot talk. One of the first sign of presentation. So you have to know what are the red flags of autism. When you will work in the periphery, in the community, if you get a child in the early stage with this sign symptom, and your findings, if you refer the children in proper child development center in the earlier stage, there will be much more improvement of these children. What are those red flags? If any child by 6 months of age having no big smile or facial expression, joyful expression, and by 9 months of age, little or no back and forth sharing of sound, smiles or other facial expressions, and by 12 months of age, no babbling, no back and forth gestures like pointing, showing, reaching or waving, little no or no response to name. If you call by name, there will be no response. And by 16 months, very few or no words. And by 24 months, very few or no meaningful two-word phrases, and cannot imitate with others. These are the early signs of autism. Who you all have seen a baby. What is the expression of a normal baby? Joyful expression. All are lacking in the 8 to 10 months, tata, baba, dada, there are lack of these sounds. And if at any age there is loss of previously acquired speech, babbling or social skill, avoidance of eye contact, persistent preference for solitude, and difficulty in understanding the other people's feeling, delay in the language, repetitive behavior or echolalia, repeating the same word, and resistance to minor change in the routine or surrounding. They don't like to change any routine in their life, and restricted interest in a limited substance, and repetitive behavior like flapping, rocking, spinning, etc., and hyperreaction to sounds, smells, or hyporeaction to sound, smell, and taste at any age. These are the signs of autism spectrum disorder. Now, you have come to know about the symptoms and signs. How will you diagnose autism spectrum disorder? It is a multidisciplinary approach by trained medical and mental health professionals using the diagnostic and statistical manual, currently in the 5th edition, which I have already told, by a behavioral observation, interview with caregiver or parents, and medical and behavioral history, and other medical tests if indicated, like EEG, MRI, some blood test, thyroid hormone test, hearing test, like this. But mostly by history and observation by the trained person, trained physician or behavioral therapist, or the person for the diagnosis of autism spectrum disorder. This is the guideline followed by the American Academy of Pediatrics, and each and every child are screened for autism spectrum disorder or developmental assessment at least twice as 18 months and 24 months. This is the guideline, have to undergo the surveillance, for which I have already told the red flags. They have been, each and every child have been assessed. What are the tools for assessment? There are so many tools. In this floor, I cannot explain everything, but in our Child Development Center, we usually screened by the modified checklist of autism in toddler, and there are so many tools used, particularly the ADOS, CARS, EDEC, ADI, SCO, and parents evaluation of developmental status. In future, you will come to know each and every tools, how they are assessed by the behavioral therapist or trained person to diagnose autism spectrum disorder. And this is one for screening. And it has the Bengali version in our country to assess the early assessment of toddler, particularly 1 to 3 years of age, having any early sign of autism, have some 7 critical criteria. If 4 or more are positive, should be evaluated further for the autism spectrum disorder. There are some differential diagnoses like attention deficit hyperactive disorder, Rett syndrome, nonverbal learning disability, obsessive compulsive disorder, and anxiety plus or cognitive delay. A few words about the Rett syndrome. It mostly occurs in the female, usually after birth remain normal. Then there is progressive increase in the size of the head, and generally between 6 months to 2 years become evident, and it is about 6 to 7 cases per 100,000 and mostly common in the girls. And hand flapping is the important feature of Rett syndrome. And all of you heard about the word ADHD. It is not the autism spectrum disorder, usually characterized by an age-inappropriate hyperactivity, impulsiveness, and inattention. They often fidget with hands or feet or squirm. They forget to take utensils. They cannot complete a work, talk excessively. These are the common features. They left their bags and other things in the school and in other places. These are the common features. So we have talked about the diagnosis, we have talked about the signs and symptoms. How we can manage the autism spectrum disorder? I have told that as there is no diagnostic lab test, at the same time, there is no pharmacological drug for the management of autism spectrum disorder, as because it is not a disease, it is a developmental condition. This developmental condition can be manipulated if we intervene in the early stage, because in the early stage, the brain becomes soft. By stimulation, by some way, we can change the behavior. They can learn, but their learning always is different from the neurotypical one. How? By psychosocial intervention, and in some cases, for specific features, a few specific features, there is some role of pharmacological intervention, not for autism spectrum, but for other conditions. What are the existing psychosocial intervention available in all? These are the evidence-based ways for intervention of the autism spectrum disorder. I will not go through in detail. Just I will tell you about the title: Early Intensive Behavioral and Developmental Intervention with a intensive and manualized intervention. Primarily utilizes the technique derived from the ABA therapy by applied behavioral analysis. These are the ways. And early start Denver model. The early start Denver model is a very promising intervention way in which parents or caregiver or therapist just play with the children alone, in one or in the group, where they become enjoy from the play therapy. So their attention, their eye contact, their motor activity become improves in the early period, and they become ready for future, for inclusion in the society. This is the main basic theory of early start Dunbar model. And another is the parent training approach. It is very important. Without the training of the parent, without the involvement of the parent, we cannot imagine improvement of the children who are in the autism spectrum. The parents' involvement by pivotal response training improves the social communication and restricted and repetitive behavior. And one important worldwide approach is the Hanan approach. Hanan more than words program for early intervention, and it is parents-based, and it usually done by the parents in daily activities with play therapy in day-to-day work. And there is tremendous outcome if a parent involved in this way. All the parents know their child, what their child like and what their child don't like. And by identifying these two and other problem in their children, they can be a therapist for intervention in the early stage of life. And social skill program, by different social skill in a group training, there may be improvement in their communication and restricted repetitive behavior. And this is the behavioral intervention and cognitive behavioral therapy for repetitive behaviors and associated symptoms. These are other way of behavioral therapy. I cannot tell in detail in this floor because we have the limitation of the time. I only asked you in future, if you know the symptoms and signs of the autism spectrum disorder, if you can diagnose the autism spectrum in the early life, it will be your graduate for early referral and intervention in the child development center. And there are other cognitive behavioral therapy. These are also evidence-based therapy. And There are some neurofeedback interventions for comorbid symptom. If there is epilepsy or other neurological conditions, have to treat them. Then sleep is a problem in case of autism spectrum disorder, and management of insomnia in autism spectrum disorder, both by mainly by the behavioral therapy. Also, sometimes our pharmacologic intervention may be administered, but major management is the behavioral therapy. And you see, this is an recognized way of educational intervention of the children and persons who are affected with autism spectrum disorder. This is the treatment and education of autistic and communication related handicapped children in the University of North Carolina. This is worldwide are utilizing. We are also taking this technique for the improvement of our children in Bangladesh. This is the part of the teach program, how a structured classroom, a structured home schedule improves the communication and education of the autistic children. And there are some computer-based approaches and virtual reality. This is a part of their management. And there are some, we call it picture exchange communication system. They cannot talk, they cannot understand other, but they are the visual learner. When we give a picture of sad, when we provide a picture of happiness to them, they understand this one by a picture. And many things they can learn by picture. These are the some steps of management of autism spectrum disorder. The role of pharmacological therapy is very minimum, but sometimes indicated in irritability, aggression, temper tantrum, and self-injurious behavior, hyperactivity and impulsivity, and inattention, along with the behavioral therapy, not alone. The FDA approved 2 drugs are the risperidone and aripiprazole in the early life for a short time, not for the whole life. And for hyperactivity management, there are some indication of methylphenidate, clonidine, and guanfacine. For repetitive and stereotype behavior and for mood change, there is indication of valproate. And there are some additional approach or complementary approach other than the behavioral therapy and drug. These are the music therapy, yoga therapy, melatonin therapy, and some vitamins and essential fatty acid may have some role in the management of autism, but they are not the primary factor for the management of autism. The primary approaches are the different behavioral therapies. What is the outcome of autism spectrum disorder? Autism spectrum disorder is typically a lifelong disorder with a highly variable severity and prognosis. So you remember, autism spectrum disorder is a neurodevelopmental disorder. It persists so long a person remain alive with ups and downs. So it's a condition. Those who have IQ more than 70, they can communicate, have the best prognosis. But early intensive behavioral interventions lead to recovery and functions in the average range. Ritualistic and repetitive behaviors may remain lifelong. The prognosis improves if the home environment is supportive, if parents are concerned, if community are concerned. So in conclusion, I want to say our perception of autism has evolved over time. 60 years ago, autism was considered as developmental delay or mental retardation. Now it is a developmental disorder. Independent neurologically based disorder, and a major public health problem worldwide, including our country. And researchers have struggled to find out a cause for autism. Despite this difficulty, researchers continue in ever more sophisticated directions, and numerous treatments have been developed that helps children with autism to maximize their potential to learn and become socially fluent. One thing you remember, if they are identified in the early life, if they are managed in the proper way, they can lead a meaningful life with neurological person. Before ending, I want to say a few words about our country. We have a conference in 2011 on autism spectrum disorder. It was the conference on autism spectrum disorder and developmental disabilities in Bangladesh and South Asia. It becomes like an earthquake, not only Bangladesh, in the world. And our leader is our national chairperson on autism, Mrs. Saima Wajed Hussain. And our PM is just like a mother of autism family. And then after, we have a national strategic plan for neurodevelopmental disorder, which is now under implementation, started from 2016 to 2021. And we have the laws in our constitution are the neurodevelopmental protection laws, and we have for our health professional, including doctors and the community workers and primary health workers, defining disability, how to diagnose autism in the earliest stage from the community, from the rural to urban area. And from birth onward, there are planning. So there are structure, but there is loss of communication, loss of coordination, lack of coordination. You are the person who, when will work in the field, you will give the emphasis, I am telling again and again, for early diagnosis of autism spectrum disorder, so that no one left behind. They are the part and parcel of our community, of our country, of our citizens. Like you and me, they have the every right to lead a normal life, but they need our help, our awareness, our activity, our commitment. And I will show you two video. Before that, I am taking bye from you. You all doing fine in this pandemic period. I will say all of you remain well, do well, and better in the future for our society, for our disabled person. Thank you so much for inviting me in your conference. I am hoping for the best. Goodbye. Thank you all.
In this lesson, we will define the core characteristics used to identify autism spectrum disorders. In addition to learning about the core features, you will observe video examples of one behavioral characteristic, restricted and repetitive patterns of behavior. What are autism spectrum disorders? Autism spectrum disorders are a group of neurodevelopmental disabilities that impact development in two core domains: social communication and restricted repetitive patterns of behavior or interest. In the area of social communication, individuals impacted by autism have deficits in social and emotional reciprocity, deficits in nonverbal communicative behaviors used for social interaction, and deficits in developing and maintaining developmentally appropriate relationships. There is a range of expression of these social communication deficits. In the area of social and emotional reciprocity, you might see abnormal social approach and failure of normal back-and-forth conversations. There may be a reduced sharing of interests, emotion, affect, and response. There may be a failure to initiate or respond to social interactions. In the area of nonverbal communication, there may be poor integrated verbal and nonverbal communication. abnormalities with eye contact and body language, or deficits in understanding the use of nonverbal communication. There may be a total lack of facial expression or the use of gestures. In the area of developing and maintaining appropriate relationships with others, there may be difficulty adjusting behavior to suit different social situations. There may be difficulties in sharing in imaginative play and in making friends. And for some, there may be an absence of interest in other people. In the area of restricted and repetitive patterns of behavior and interest, the individual must express at least two of the following: stereotyped or repetitive motor movements, use of objects or speech, insistence on sameness with inflexible adherence to routines or ritualized patterns of behavior, highly restricted, fixated interests, abnormal in either intensity or focus, or a hypo or hyper reactivity to sensory input or unusual interest in sensory aspects of the environment. Just like in the area of social communication, there's a range of expression of these differences in repetitive patterns of behavior and interest. Repetitive motor movements could include motor stereotypies, such as rocking or hand flapping, lining up or flipping objects. There could be the presence of echolalia, or repetitive speech, or the presence of idiosyncratic speech. In the area of inflexibility and adherence to routines, you might see extreme distress at small changes, difficulty with transitions, rigid thinking patterns, rituals related to greetings, and the insistence on the same route or the same food choices at each meal. In the area of restricted or fixated interests, there may be a strong attachment to or preoccupation with unusual objects. There may be excessively circumscribed or perseverative interests that the individual may spend a great deal of time talking about or investigating. In the area of sensory, there may be indifference to pain or temperature. There may be an adverse response to certain sounds or textures, excessive smelling or touching of objects, or visual fascination with things like lights or the movement of objects. In this video segment, you will see examples of some of the restricted and repetitive patterns of behavior often seen in individuals with an autism spectrum disorder. These include spinning, preoccupation with a specific object, in this case the letter I, and an unwillingness to shift from the preoccupation, even with encouragement. You should also note the general lack of joint attention and sharing of enjoyment.
Dancer. Oh, she's dancing big now.
Yeah, push another button. Wow. Which one of these?
Ethan, are you playing the computer with Daddy?
He's playing the computer.
Ethan.
He's playing the computer with Dad. Push this one. Oh, you like the I? That's the letter I.
Ethan.
Push this one. Push this one.
Push the S for snake.
Push this one. Oh, you like the I?
In this lesson, we will identify the characteristics of infant and toddler development and some of the red flags for autism spectrum disorders to watch for. We will also compare and contrast behaviors of typically developing children with those of children on the autism spectrum in a short video segment. Research has indicated that there is a significantly increased risk of a younger sibling developing or showing signs of autism if they have an older sibling who's been diagnosed on the autism spectrum. Studying the younger siblings of children with autism has given us a substantial amount of information about the early signs and indicators. Some of the red flags indicated in infant development include no big smile or other warm, joyful expression by 6 months of age or thereafter. No back and forth sharing of sounds, smiles, or other facial expressions by 9 months of age or thereafter. No babbling by 12 months of age. No use of back and forth gestures such as pointing, showing, reaching, or waving. No words by 18 months of age, and no 2-word meaningful phrases by the 24-month age. And any noted loss of speech, babbling, or social interaction are a red flag for autism. There are also several red flags during toddler development. A lack or delay in spoken language is often the first sign and symptom recognized during this period of development. There may also be a limited use of gestures or pointing to reference objects. There may be limited pretend play or inappropriate play with objects, such as lining things up or engaging in repetitive patterns of behavior with toys and objects. There may be a limited interest in other children and a limited sharing of enjoyment or emotional reciprocity. You may see sensory avoidant behaviors, such as a refusal to wear shoes or clothing or eat certain foods. And while tantrums are common in the toddler years, there may be extreme tantrums where the child is simply inconsolable. In the following video segment, you will see 2 toddlers. One who is typically developing, and one who was soon after this segment diagnosed with an autism spectrum disorder. As you observe the videos, pay particular attention to social engagement and how each child interacts with both objects and people.
Look at you running. Good running. Come on, keep running. That's our doggy. Roof, roof. Ruff, ruff. Roof, roof, roof.
Ashes, y'all fall down. Ethan, look at mommy. Look at mommy, Ethan. Look at mommy. You made a big mess over there with all your stories, huh?